Hello, doctor. My name is Dr. Kronk. I'm the CEO of Spinal Kinetics. We're a medical testing company that does excessive motion testing to pick up damage to the non-disc or the spinal support ligament. These ligament injuries are some of the most important injuries in the market today, bar none. I'm a huge advocate that they should be done with an unbiased, independent, third-party read whenever possible, done by a medical radiologist. Now, there are doctors out in the market today that are using softwares. And on some of these softwares, the technology is so old. I don't know how the softwares are still there. They're that old because they're still promoting screen capture technology. Screen capture technology is just, I'm just going to give you one example. I could list off 10 or 20 examples of potential flaws that these systems have. I'm going to give you one that's very common in the market today. They're using a screen capture technology. Now, the screen capture technology means you're taking a picture of the picture. It means that you're going to take a picture of an X-ray. You're going to screen capture a picture of an X-ray, either out of a portal, or you're going to screen capture it because you brought it up in the software, you brought it up in a viewer system, and you're taking a screen capture of that software. You now have inaccuracies in the software, in some cases major inaccuracies. Because the idea is now that you're going to calibrate to that image. And I don't care if you have an imaging strip on it or you have a artifact that you've placed in it. When you have that artifact or you have that strip, now you have an inaccuracy because somebody has to place a point on one end. Let's say you got a 10mm strip. Somebody has to place a point on one end of that strip. It's not going to be accurate. The accurate placement is not going to be right at the exact point. Now you have to place a point at the other end of that calibration strip. Guess what? That's another inaccuracy. So now you have two inaccuracies. We haven't even talked about the possible inaccuracies you have with the screen capture itself. There's many inaccuracies that can occur with that. So if I have to do that on two studies, and I have to do that, I have a range of error now already factored in that should not be factored in. So I'm already inaccurate. Like I definitely, if you're using screen capture software and you're doing procedures like this, I would not do these procedures in my own office, and I certainly would not bill for them. That would be something that I would be totally against. If you're going to use it, don't bill for it. And the reason why you don't want to bill for it is once you bill for it, you're responsible for explaining this old, outdated technology. And there are going to be experts that really understand what this stuff is. Right now, there's not many in the market. But when it comes to this type of testing procedure, you don't want to, screen capture technology is pretty old. I mean, it's easily 6, 7, 10 years old. It's old, maybe more. So that's not something that you want to be using. I highly recommend that if you're going to be doing excessive motion testing, do it with the best company you can find to do it. Do it at the highest level of professionals that you can find to do it. Right now, I believe that's Spinal Kinetics in the market. We pioneered this procedure. We pioneered additional technology, AI technology, to improve on this procedure, to standardize it, so that eventually it is a standard procedure that's done on every set of flexion extension X-rays. Because it should be. You can't tell how damaged the spine is without an excessive motion test. Because it's the excessive motion test that tells you how damaged the spinal support ligaments are, and those spinal support ligaments are some of the most important ligaments to the spine that there are. They cause more trauma and more problems than the disc herniations. Now, the disc herniation is a very important injury. I'm not minimizing that. But 3 general disc herniations, or 5 general disc herniations, 2 in the lumbar spine and 3 in the cervical spine, do not account for the majority of everything that a patient has. And they certainly don't account for the symptoms of the mild traumatic brain injury. Those generally are not caused by a disc herniation, but they can very definitely be caused by spinal support ligament issues and damage. So choose the best that you can find to do this type of testing. That's always my advice.